Okay, today we're going to be working on a soap note. I have my patient here, Atlas. Atlas, what brings you in today?
I have some shoulder pain.
Some shoulder pain.
Mm-hmm.
Okay. Can you show me where it is?
Right here on the top.
Okay. And with one or two fingers, can you point to where the pain is?
Right here.
Okay. So when did this happen? When did the pain start? Do you remember what happened and what caused it?
It happened about a couple months ago. I think I started boxing a little bit more, and it started to feel tender after training.
Gotcha. Pain only on the anterior front side, or
Correct.
is there some pain on the posterior side?
None on the back.
Just anterior.
Yeah.
Okay. Gotcha. Have you ever had any type of accidents or injuries in this right shoulder before?
No, I haven't.
And no symptoms like, actually describe your pain for me. What does it feel like? Is it burning, aching?
It's more like an aching or like a twinge or
Okay.
just localized right there in that one spot.
Okay, gotcha. That looks like it's right at the AC joint.
Mm-hmm.
But I'm going to ask a few more questions. Do you have any nerve pain?
No,
Any shooting?
the pain does not
numbness and
extend
tingling?
to the rest of my arm at all. No.
Gotcha. Okay. Are you taking anything to make it better? Any as far as medication or supplements?
No, I'm not.
Gotcha. Okay. And is there anything that makes it better? Is there anything that makes it worse?
I think just like lifting my arm up
Overhead.
and then kind of just overhead movements and moving it like this, and then obviously after training it flares up and it's a little bit more tender. But I think just relaxing would be the main thing that would relieve the pain.
So it sounds like the pain is constant. It's there throughout the day, or does it ever go away?
Yeah, I mean it'll kind of dissipate to the point where I don't really notice it, but I think it's pretty constant, especially days where I've trained and immediately after training I can feel a lot. But usually throughout the day it'll be there, especially when I'm moving it, but it's not intense enough for me to really notice it.
So with that being said, on a scale of 1 to 10, 10 being we need to take you to the hospital right now, what is it at its best, pain, and what is it at its worst when it's absolutely killing you?
I think at its best, like a 1 to 2, and then at its worst, probably like a 6. I would say 6.5.
Gotcha. Okay. So now tell me a little bit about your exercise.
So
How many days?
Yeah.
And what intensity?
I work out probably 5 to 6 days a week.
Holy smokes! Okay.
And most of it is boxing related, sparring, hitting the bag. But then occasionally I'll also do some weight training. When it comes to arms, like push movements, shoulder press, dumbbell press, and other chest and back exercises.
Okay. Gotcha. It looks like you're hitting all those muscles. It seems like you're working hard 5 to 6 times a week. You think you're getting adequate rest? Are you sleeping?
Yeah, I mean, occasionally I think that I could be getting more sleep.
Have you talked to your doctor potentially about any medication or?
I have not.
Gotcha.
I think that maybe in the near future, if it gets any more intense, I would. But
See,
right now, it's more just like an irritation rather than anything.
You said you would. So I see a doctor?
Yeah.
Okay, gotcha. Yeah, that would be great to maybe get some imaging done.
Sure.
So I'm going to assume you haven't got any imaging done,
I have
no
not.
x-rays, no MRIs, no CT scans,
Nope.
no CAT scans, orthograms. Okay, gotcha. And then I know you say you're not taking any medication, but are you allergic to any medication?
Not allergic, no allergies, as
Awesome.
far as I'm concerned.
Good. Okay. I'm going to ask you a couple quick questions about your family, if that's okay with you.
Sure.
So is there any family history of chronic pain or chronic illnesses or anything significant as far as pain that is
genetic or something.
Well, that's unbearable. I would say.
I see. No, I don't think so. I don't think anybody in my family has anything worth noting.
Gotcha. Okay. What do you do for a living? What's your job?
I'm a farmer.
Okay.
So
Probably
I'm
working.
outside, you know, sometimes I'm also in the office a lot. But occasionally I'll have to lift some heavy objects, but it's not, you know, part of my day-to-day work schedule.
Okay. And does that make the pain worse?
Yeah, I think any sort of, you know, overhead movement or movement with my shoulder, especially with lifting really heavy stuff, could hurt it, but usually throughout my work day, there's nothing that, you know, agitates it as much as training does.
And do you ever ice after training or work?
I have not been icing now.
Gotcha. Okay. Could be something to try out. How about your diet? Do you watch what you eat?
Yeah, I eat pretty clean. I try to maintain my, you know, maintenance level of calories, and I try to watch my macros so that I'm getting, you know, the right amount of protein for weightlifting and training. And I eat relatively clean. I usually cook my own food.
Great. And then any tobacco use or
No
use
tobacco.
of any recreational drugs?
No.
And getting back to family, in the family, is there any family history of maybe either chronic mental illness or chronic substance abuse?
No.
None at all?
Not that I'm aware of, no.
Great. And do you feel that you have support, or that if the pain gets to the point where you really need some support, that you would be able to find it?
I think so, yeah.
You have a doctor that you trust?
I have a doctor, yeah.
Gotcha. And then has it affected your mental state of mind? Does it, change your day to day because of the pain? Does it ever get in the way of everyday activities?
No, I don't think it affects my mental, but it definitely can affect, the level of intensity of training.
Yep, absolutely. Definitely alters the, what you're allowed to do and
right.
how much you want to do.
What I can withstand.
I could imagine that's frustrating because you probably want to train as hard as you possibly can.
Yeah, it can be frustrating.
The trade-off can be very tricky.
Sure.
So one last time, does anything make it better that you tried other than rest? I know you mentioned rest.
No, but I mean, now that you mention it, I think that I could try icing it. Maybe some Tylenol.
I was gonna say maybe some ibuprofen, maybe some Advil could help.
Yeah.
With that area.
Inflammation.
And then one more time, I want you to point to it, but is it right here?
Right there. Yeah, you got it. Right there.
It looks like it's right at that AC joint. And that's all I got for you. Thank you so much.
Thank you so much.
We're going to work on some special tests soon.